Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Percolation. This audio podcast is part of the Bostics and Torpedo and the Specials. This audio podcast is part of a Spectre and Newsflash, and this audio podcast is part of a Storm Lobostics production. So finally, in this audio podcast, looking at the some of the conclusions in some fantastic work that M. Hussain had 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 developed and had developed in around looking at the diagnoses of osteomyelitis and S. aureus, Staph aureus in as part of the diagnoses. So some conclusions in around this works. And again, listeners and viewers, just to inform that this works this works, or this audio podcast will have some list of sort of citations and references, and this work is accredited to the main author, being M. Hussain, and details will be in as part of the some of the written information in as part of the this audio podcast series. So some conclusions then. So staphylococcal infections are concerning, or can be concerning, and can be a clinical challenge due to their ability to evade host immune system, as well as resistance to antibiotic pharmacotherapeutics. In particular, MRSA infections are of great apprehension in hospital environs. Their ability to cause and spread nosocomial infection, for example, amongst already susceptible recipients, can be fatal. Both hospital and community acquired MRSA are correlated with morbidity and mortality, and burden. Furthermore, to combat MRSA infection and sort of infection to combat MRSA infection, extraction of necrotic tissue through surgical debridement only aggravates patient impairment, which results in exacerbation of susceptibility to nosocomial infection. Moreover, it is important that the surveillance of S. aureus infection is carried out, or is carried through through laboratory investigations to reduce to preclude the potential risk of MRSA outbreaks for example, hospital environs. Um, uh, Sorry, as to preclude the risk of MRSA outbreaks within hospital environs. And at the same time, it is also for this on this basis that accurate genotypic laboratory investigations of bacterial identification and taxonomy should be utilized to serve to determine sort of S. aureus infections. So finally, susceptibility, antimicrobial susceptibility investigations and microbial stewardship are of great importance in the in sort of the prospective sort of monitoring and management of and preclusion of precluding and the precluding of MRSA, and that aligned to the diagnoses of osteomyelitis, and the diagnosis of osteomyelitis, and through the investigations of aureus. That draws this audio podcast to a close. This audio podcast as part of the Percolation. This audio podcast as part of a Bostic's Torpedo and the Specials. This audio podcast as part of a Spectra and Newsflash, and this audio podcast as part of a Storm Lobostics production.